Please help spread the message of Frequency Specific Microcurrent by clicking on the like button. You can subscribe to us on YouTube or any podcast app. If you have any questions, please leave them in the comments. You can find the podcast transcription at frequencyspecific.com, as well as more information about Frequency Specific Microcurrent. 3 o'clock.
I'm on. It's 3 o'clock. Welcome to what the podcast looks like when Kim is in Florida, can't make it back or get to the podcast. Let's see. Oh, goody. Thank you, Jennifer. You give me something to talk about. I'm not very good at setting themes because I go with the flow. So we have a question from Jennifer already. Yay. I'm getting a new client who had a stroke, full blockage in the right carotid. Ooh. Only able to see the picture the doctor drew. It looks like a middle internal carotid that goes to the brain. Only 35? They think it's better not to try and fix the block? Okay. Watch some YouTube videos from Johns Hopkins who agree that if the body has found an alternate route, that's good. Instincts just don't agree, just asking for a referral. Or just a breakdown of logic. They currently just want me to do cranios. Also, they want to surgically insert a vagus nerve stimulator. What? Okay, wait. Now I'm confused. She's got a blocked internal carotid. She's 35. That says something about something. And they want to insert a vagus nerve stimulator. It is inserted close to the carotid. A lot of questions to ask. I don't agree with it, but this is not my expertise. I just think they should find out why the vagus nerve isn't working. They made it sound like they said it was broken, but I don't think so. And that's all I can read, Jennifer. There's got to be another part to the story. The vagus nerve stimulators are approved for seizures, gastroparesis, depression, migraines. What indication do they have? Oh, there we go. Thank you. What indications do they have? Anxiety. That's it. They're inserting a vagal nerve stimulator instead of giving her even medication or supplements for anxiety. Okay. What's your clinical degree? What do you do? And medications too. Great. At 35, she may or may not have internal fortitude to argue with them or say, yeah, I'd really rather not do that. Depending on your specialty, your clinical degree, you can suggest to the patient that maybe she look up the side effects and the massage only a massage therapist. Yeah, your massage therapists are really important. So you are a massage therapist, not only a massage therapist, but that's another conversation. You can't tell her, oh my God, why would you let them put in a vagus nerve stimulator? I'm assuming it's her left carotid that's blocked because they put the vagal nerve stimulators usually on the left. So you can't tell her to tell them no, because you're a massage therapist. I couldn't tell her to tell them no because I'm only a chiropractor. But you can sit there with her and say, have you looked up the side effects of vagal nerve stimulators and how long they last? Those are two really good questions that are worth asking. The next thing I would do that might be inside your scope is ask her the vestibular questions. When did you start being anxious? During what situations are you the most anxious? Is she anxious all the time? Is she anxious when she goes outside? Is she anxious when she reads or watches a movie? When is she anxious? All the time? They are new and no studies so far. Oh, vagal nerve stimulators for anxiety. Yeah. I do a vestibular screen on her and find out if that is a cause of anxiety. Keep your head straight forward, follow my finger with your eyes, ask her all the vestibular questions. When and where do you get anxious? And then what was the other cause of anxiety? Does she have digestive problems? What's her heart rate? Is she hypermobile? So Ehlers-Danlos or hypermobility syndrome patients are universally anxious and or depressed. So have her put her hand on the desk and just raise the little finger. And if it goes to 90 degrees, check her elbows, do the Baton score, BEIGHTON. If you don't remember it from the core, look it up on the internet, BEIGHTON. And what does your thumb do? So what does your little finger do? What does your thumb do? What does your elbow do? Does it go backwards? Do your knees go backwards? And can you bend forward and touch your hands to the floor? So that's another cause of anxiety. Vestibular injuries are a cause of anxiety, and Ehlers-Danlos patients seem to have more of those. And then the other cause of anxiety is mold. Oh, you already checked. Good for you. You get extra points. If I had chocolate, I would throw some at you. It's not hypermobile. Mold is another one. So has she been anxious her whole life? Did she start being anxious at a certain age? So what started it? The challenge with vagal nerve stimulators is that once they're in, you can't take them out. And maybe just let's look up vagal nerve stimulators, and they're on your phone, right? They're on your phone. It's, oh, yep, that's where they put them. That's how it's installed. There it is. And then, oh, there's this thing that says side effects of vagal nerve stimulators. And they are not always benign. So help her make a decision. The other question that I would have, there is something causing a lot of inflammation. She's only 35. And oh, the right carotid. So they're going to install the vagal nerve stimulator on the left. Why is her right carotid almost completely blocked? Does that make sense to you? Did I miss something? Does her family have a history of heart disease? Thank you for checking. Doing urine mold testing is outside your scope. But if you know somebody around, you can talk to her about there are other causes of anxiety besides vagal nerve dysfunction. Their medication's not working. How anxious are you? Check for a vestibular injury, check for mold. The easiest way to check for mold is have her to say, and see if her palate goes up. And then have her wash her hands and put her finger down her throat and see if she has a gag reflex. So if the palate doesn't go up, there's no gag reflex. Yes, indeed, the vagus is not working. That's how Neil checked me for mold before I did the real-time labs test. And with mold, it's like your body is anxious. Now, the FSM protocols for mold are helpful. One of the things you can do while you're doing a massage on her to calm her down is run vagal tone or concussion in vagus, but that takes a little bit longer. So there's that. That's a great case. And it brings us to that same topic that we had last week about how multi-layered things are, that there are layers. So FSM is an adjunct, but it's why in the core, I spend so much time on differential diagnosis. Is it mold? Is it a vestibular injury? Is it a head injury? Is it root canals? That's another good question. Does she have any root canals? At age 35, it doesn't make any sense that the internal carotid on the right alone is blocked. If both internal carotids had blockages, that would make more sense than just the right. So you might ask her, does she have any root canals? And then the book that I read was The Great Root Canal Cover-Up. And that's a whole nother conversation that may or may not be inside yours. You can't make a diagnosis, but you can have a conversation. Go for it. What causes that carotid to be blocked at the age of 35? Only thing that makes sense is some other infection like a root canal. Okay, Dana, trying to improve hydration in order for FSM to work better. I have a confession to make. I think what I decided about hydration in 1997 might not have been correct. I suspect that the FSM was not working because I didn't know what I was doing and I wasn't treating the right thing. So back in 97 through really until about 10 years ago, we were treating the muscle as if the muscle is the problem. Now the problem is figuring out the underlying cause of what's making the muscle tight. Hydrate supplement and the hydrogen generating water bottle. Dana, if you can explain to me how the hydrogen generating water bottle works, I would be fascinated, because there's no place for the hydrogen to go, as far as I know. Water is H2O. There's two spots in the outer shell of an oxygen molecule for hydrogens to attach to. In order to create H3O, in order to add more hydrogen to water, it takes a nuclear reactor, as far as I know. Heavy water is some sort of precursor to making nuclear weapons from every TV show I've ever watched. It does evaporate quickly, and just for the record, if it really is generating hydrogen, you know that hydrogen's explosive, right? It blows up. I'm sure there's not enough to get it to pop, because we did it in chemistry class. You make a little bit of hydrogen and then ignite it, and there's this little pop, and it's one of those experiments that juniors in high school really like to do. And the health benefits of hydrogen is something I'm not educated about. Clinically, it doesn't make sense to me, because oxygen is what your body needs for all of its biochemical functions. And okay, thank you. Dana said, I'll ask my husband about the details. He's an organic chemistry professor. What you really need is a biochemistry professor or somebody that knows biochemistry. Organic chemistry, you can do all sorts of cool stuff. Force things chemically to do what you want them to do. Organic chemistry was so much fun. Biochemistry is what happens in the human body. So I guess I would look up what hydrogen does in the human body. I know it's a thing that has become more popular in the last 2 or 3 years. So there's that. But I don't know about hydrogen in the human body. If I was going to inhale anything, I'd inhale oxygen. Okay, so ask your husband about it, see what he says. Suzanne, oh, I'm so glad you guys are asking questions. 80-year-old with severe scoliosis. Severe, I'm assuming, is more than 40 degrees. Partial hysterectomy due to fibroids. Bladder lift, oh dear, decades ago did reflex muscles, sensory and muscles for sure were fine. Not sure about the reflexes, maybe need more experience. Yeah, they're not always easy to get. Reduced movement and stiffness in the abdomen. The hysterectomy would explain that. Oh, cat litter. Cat litter in the abdomen sounds like maybe the intestines. All the visceral organs plus, so I'm assuming inflammation in the visceral organs plus 3 and 97. So sclerosis in the adipose seem to have the best result in terms of movement, but there's still lots of cat litter. Had great result with thoracic outlet protocol. Ran C-spine, found that lightly touching the lower C-spine muscles cause tingling in the legs, not the arms. Lightly touching. This afternoon, she had a nerve conduction and no results because she had tingling in the hands. Biceps and triceps also caused her to jerk her arms and her legs. Yikes. If somebody has a disc bulge that's pushing on the spinal cord and you lift up on the C-spine and you lift up on the C-spine and it pushes the disc into the spinal cord, you can have tingling or tightness in the legs, lightly touching. That's intriguing. So remember the part of the core where I told you the patients would get more complicated? This is one of those things. As you're lightly touching the lower C-spine, takes me back to severe scoliosis. And the scoliosis combined with the age, combined with the reflexes, combined with the fact that when you check her biceps and triceps, it makes her legs jerk. I would go looking for or ask her GP to look for stenosis in the cervical or thoracic spine, because that's where there's a spinal cord. And the challenge with getting them to do that is that by the time you're 80, with a non-surgical scoliosis, because by the time they're 80, nobody's going to do surgery on the scoliosis. Getting an MD or an insurance company to approve the kind of imaging you need, like an MRI of the cervical and thoracic spine, that's going to be tricky. I would try 40 and 10 or 81 and 10. The cat litter in the abdomen. So you ran the visceral organs. I'd run the gut, primarily the small intestine, and try for parasites or pus and pus encapsulated and fermentative and putrefactive toxin, and ask her if she travels, she or he. Bladder lift, that's always female. If they travel, so is it parasite? Is it SIBO? How's the rest of her digestion? So these are two separate problems. One is the 81 and 10 cause there to be a sensation like standing on a rock. Does that mean her feet hurt when you ran 81 and 10? under her right foot. So it made her right foot hurt. 40 and 10. Grew up on a farm. But if she grew up on a farm and she's 80 now, it seems like there would be, I have a confession to make. So much of the diagnoses I do is with my hands and in person with the patient. Really tight abdominal muscles. Any chance she's allergic to the mesh? Because the bladder lift is accomplished with mesh. They call it a bladder lift, but it's really the pelvic floor that they lift. I wonder about that. And is it all over her abdomen? Is it the small bowel? And what's wrong with the small bowel? 81 and 10. Standing on a rock. 9 and 37. All over the abdomen. You could also try 9 and 22. So you could try 9 in the bladder, allergy in the bladder, allergy in the fascia, right? So the fascia could be reacting to the mesh. I'm assuming you already ran parasites in the small intestine and pus encapsulated and inflammation. Oh, toxicity. Okay. Louise says she grew up on a farm. Yes. Exposed to spraying, toxicity. And is there any indication? Does she have any tremor in her hands? We can't get back up to the top part. When you do her upper reflexes, her legs jerk. That's not normal. That's hyperreflexia. And that makes me think that there's something going on in the spinal cord that's maybe separate from what's going on in the gut. No, there's no tremor, so she doesn't have Parkinson's. So, yeah, there's something going on in the spinal cord, that's for sure. And what does 40 and 10 do? The other place I'd head. Two separate problems. One affects her reflexes and the tingling, and one affects the belly. Good. Suzanne says, thanks. I got some additional ideas. That's a good thing because I'm just rambling. That's how my head works. What to look for based on what piece of what I found. Are these the emails that Kim sent?
No, but these are ones that were submitted, but I'm not sure if we ever got to them.
Okay. We do have some emails that were sent in by practitioners. So not sure if you've answered these. I'm excited to have discovered FSM. I'm excited that you discovered it. Hope to learn more in the future. That is unending. Wondering if anyone knows of success in heating spermatocele or hydrocele in the scrotum. It's another one of those mystery ailments they say you just have to live with. Don't you love it when they say that? That's interesting. In the new advanced laminate, I just updated the advanced laminate the other day. Ben Catholi asked me for an updated advanced laminate. So I took a bunch of George's experimental frequencies, and he had frequencies for the epididymis and for the vas deferens. And I guess I'd love to pretend that I remember what's involved in a spermatocele and a hydrocele. But basically, it sounds like what I remember about them is that the tubing is swollen and the scrotum is swollen, inflamed, painful. And so there's two things. Number one, why is it inflamed? So you could go to just running inflammation in the scrotum, inflammation in the vas, inflammation in the spermatic cord, inflammation in the prostatic plexus, inflammation in the epididymis and the vas. And those are experimental, so I don't know if they're correct or not. And then the other thing is ask him if he's had a blow to his testicles that would have caused scar tissue that would inhibit the flow of fluid, because fluid always moves. It's like it's produced someplace and it goes someplace. I don't think there's anything in the body that's static as long as it's liquid. And if there's scar tissue, so if he's playing soccer or football or got in a bar fight, the sorts of places where scrotums get injured, then you could try running scar tissue on that tubing and then run inflammation and vitality and see if you can help. The good news is that since there's nothing else that anybody is going to do, then you haven't got anything to lose. Good luck, Chris. Let me know if it helps. This is another email. 64-year-old female with chemo-induced neuropathy that isn't responding to the neuropathy protocols. Central pain, sensory and motor in the spine, some response after the first chemo infusion, but no. Joy, hold that thought. But no response now. I asked what is different with this patient and came up with aggressive breast cancer, so aggressive they're using Taxol. She said she was offered ice packs for feet and hands during the infusion, and pain from the ice was incredible. Yeah, then nerves get really hypersensitive. Was told that if she could tolerate the pain, the ice may help. She kept the ice packs on, even though it felt like frostbite. Describes neuropathy as numb, heavy bricks, just like they are sleeping all the time. Wow. Okay. Oh dear. Patient is 3 to 4 hours from me and has a custom care that she can reprogram, or some unit she can reprogram. Here's the problem. We have pretty good success with the chemotherapy agents in the family of vincristine. I'm not sure what family Taxol falls in. The platinum-based cisplatin and the platinum-based chemotherapy agents. Let me look up Taxol. Yeah. Taxol and carboplatin. Okay, let me look up Taxol. Taxol is platinum-based. That's the problem. So far, we have not had any success with the platinum-based chemotherapy agents. They destroy the DNA in the axon in the spinal cord and the peripheral nerves. And the medical response is that's better than dying of aggressive breast cancer. And live with it. That, yeah, I've never had any success with it. So you use all of our, from the advanced, use all of the frequencies for toxicity, organic and inorganic toxins and poisons. You could also try, because the last cisplatin chemotherapy patient I treated, we weren't using the solfeggio frequencies. So there's a solfeggio frequency to repair DNA, and you could try that. What is it, 528? You could try that with the nerve and the cord. The little icon for whatever browser you use that's on your phone, I use it all the time in the clinic. There was a patient in this week, as a matter of fact. She's also a practitioner, but she was in the office this week as a patient and had her blood work. And her blood work shows that she's anemic. And so her doctor told her she needed to eat more meat. And she said, I have rheumatoid arthritis. I had a positive 7 years ago. She's 73. Anyway, she's in her 70s. So she develops a positive RA and joint pain in her 60s, unusual. And then she has no visible signs of rheumatoid arthritis. So she was on this immune suppressant drug. So basically she had a positive RA and they said, oh, good, you have rheumatoid arthritis. Now you can be in our study. So they put her on this new immune suppressant drug for the rheumatoid arthritis. And it didn't seem to be doing much. So she spent 6 years on it, then took herself off a month ago. And I looked the drug up. And one of the common side effects is anemia. In the blood work she brought in with her, done just a month ago, she's anemic. Her hemoglobin and her hematocrit are both low. And it had nothing to do with her diet. It had to do with this immune suppressant that she was on. So there are times when it's really helpful to have the little Dr. Google on your phone so you can look stuff up, just to put things together in your head as you're trying to figure out what to do. So I am really sorry, whoever sent the email about the chemo-induced neuropathy patient. Can't put tissue back that's not there. You can try, I think it's 528 from the solfeggios for repairing the DNA. Leaf said, how about carcinoma toxins for encouraging the body's response to the tumor? That would be good. They're going to keep her on Taxol anyway. So 77 and 95 on channel A with whatever tissue on channel B. That's the thought. And Joy Mitchell, how would you treat loss of smell and taste due to COVID? The flu respiratory protocol that we used for COVID, but it's called the flu respiratory protocol in the custom care mode bank, are the 6 virus frequencies: 41, 44, 56, 160, 189. Those were the 6 virus frequencies they had in 1922 from the epidemic in 15, the epidemic in 17, and then the pandemic in 19. They had these frequencies. And when you look at how we smell, it's the ethmoid sinus. And I've got, for those of you that are listening, I've got my finger up here, the bridge of my nose, up in between my eyebrows, because that's where the ethmoid plate is. And it is dense, little teeny nerve and capillaries. So I put one contact on the forehead and one basically on the front of the neck, and run the 6 virus frequencies with the capillaries and 6 virus frequencies with the ethmoid. And I guess you could add the tongue. That's a thought. And so far, it's never failed. So at some point, there's got to be somebody it doesn't work on, but so far I haven't run into them. Usually they run about 4 minutes a piece, roughly, and see how that works. Smell comes back first, and the sense of taste is so closely related to the sense of smell that they're combined. You could also add the frontal lobe, the cortex 90, and see if that participates in smell and taste. But that works really well. It's 38, 41, 44, 56, 160, 189. Wow, you guys are doing great today. Thank you for keeping me company. I miss Kim, but she's having fun in Florida. Dana, 65-year-old female veteran. Okay. Which military service is, and what was her job in the military? With a healthy diet, healthy weight, exercises regularly, has dangerously high cholesterol. Cardiologist doesn't have any other advice besides medication. She's looking to try dream therapy. Is that a typo? Is that for real? Okay. So I want to suggest FSM to try the 970s, maybe PTSD, and wondering if you have thoughts on mysteriously high cholesterol. The question is, how high? What they consider high is 220 to 250. By the time you're 65, your cholesterol should go up because your adrenals have to make all of your steroid hormones, estrogen, progesterone, testosterone, cortisol. Every endocrine hormone is made on a cholesterol frame. It looks like a chicken wire diagram. And then there's different things hanging off of different parts of the chicken wire that make it into that particular hormone. Dangerously high, I'd say 300, 400, 600 in that range. That's dangerously high. 250 is not dangerously high. The cardiologist is going to want to put her on statins. That's a terrible idea because of its effect on brain function and muscle. But there is a binder that binds cholesterol in the gut called cholestyramine, and she can use that. He won't think of it because it's old. It's not the statin thing. It's not even the new statin thing. And her cholesterol is unlikely to be high because of PTSD, but if she has PTSD, so you can have her fill out the PTSD scale, civilian and military, or just the military one that we have on our resources page for practitioners, and see if she has PTSD. With FSM, I would run concussion and vagus and have her come in the morning and run adrenal support. I'm assuming she's not fatigued, but she might be. Find out exactly what the cholesterol value is, and cholestyramine is not going to hurt anything. The worst thing that it does sometimes is cause constipation, but in almost equal measure, it can cause loose stools. And it just binds cholesterol in the gut, so it's not recirculated. Arguing with a cardiologist who thinks that cholesterol causes heart disease is useless. So don't waste your breath or hers. Concussion and vagus is a good place to start treating her liver. That's the thing. You can have, that's a thought. See, the liver produces cholesterol. You can have a completely cholesterol-free diet, no cholesterol, zero fat in your diet, zero cholesterol in your diet, zero. And your liver will make however much cholesterol it thinks you need. What if you ran liver support, liver toxicity, depending on where she's served in the military? If she was exposed to the burn pits at all, or they're vaccinated, so she has exposure to toxins. What if her liver has an opinion about that? And so I'd run liver support, concussion in vagus, and have her tell her cardiologist that she'll try 3 months on cholestyramine and see if that takes her cholesterol down into the 200 to 250 range. Dangerously high back when I sold cholesterol medication was like 300 to 600. So there we go. 14-year-old. Oh, Kate says, before they started promoting statins, They used to say 150 plus your age for cholesterol levels. Oh, so mine are perfect. That's really cool. That's a good thing to know. Oh, let me finish with Joy. How long does it take before smell and taste return after the FSM treatment? Every single patient I've treated for loss of smell has gotten up off the table and was able to smell. So patient goes in to the restroom to empty their bladder and wash their hands and then put on lavender scented hand cream. And that was, and then she went, I can smell the lavender. So it's really pretty fast. You might need more than one treatment. Okay, Suzanne. 14-year-old female with EDS. Ooh. Rare genetic bleeding disorder not well, along with Tourette's. Yikes. Have not treated EDS yet. That's straightforward. Stop bleeding and see if it helps. 18 and 62. The question about the bleeding disorder is what piece of that, when you go from bleeding to clotting, that cascade has multiple genes involved, and not well characterized means they haven't found the gene, along with Tourette's. Where's Ben Catholi when you need him? Tourette's, I think, is basal ganglia. Anything else for this poor kid that has lots of pain? That's 40 and 10. So when you treat Ehlers-Danlos, you go 40 and 10 with 1 unit, 120. So reduce inflammation in the spinal cord. That's what causes the body pain. So if what she cares about is the body pain, then run 40 and 10. It won't hold because the connective tissue in the disc annulus is really leaky, and because she has Ehlers-Danlos. So it's not going to hold. So in a perfect world, you would have 3 units on her. You can do it all with custom cares. Neck to feet with 124 and 77, neck to feet with 40 and 10, neck to abdomen with concussion and vagus. I have no idea if the concussion protocol is going to help the Tourette's. I'd have to use my Dr. Google to find out what brain part is associated with Tourette's. I have a feeling it's the basal ganglia. I got extra points. It is the basal ganglia. So we have a frequency for basal ganglia that works really well. And that is basal ganglia. Thank you, JJ. By the way, for those of you that are using the eye care, JJ got product liability insurance. Okay, so the basal ganglia is 988. So I would run trauma in the basal ganglia, torn and broken in the basal ganglia, 40 in the basal ganglia, also neck to feet and C. The brother has Ehlers-Danlos, the bleeding disorders, and seizures. Vagal nerve stimulators are approved for the prevention and treatment of seizures. The third thing you run is concussion and vagus. On the brother, you'd run just vagal tone with an increased amount of time on increased secretions in the vagus. They all have EDS, so they all need 124 and 77. Suzanne, yeah, grand mal, those are no fun. They're scary and they hurt. They're really, you end up breaking things and bruising things, and those are hard. But I don't know, get all 3 of them in at one time and see if you can figure out a way to treat them all at one time for 124 and 77. LP. Not part of the lipoprotein A. Yeah, it's the one that's associated with cardiovascular risk. But once again, there are so many things that contribute to cardiovascular disease. If you listen to Mark Houston and you read what your doctor might not tell you about heart disease, he says heart disease is inflammation, autoimmune dysfunction, and oxidative stress. So find out if she has any root canals, mold exposure, some sort of source of chronic inflammation that keeps the immune system turned on or keeps the vagus turned down. So the vagus is in charge of reducing inflammation. Cardiovascular disease is an inflammatory response in the blood vessels in the heart to inflammation, inflammatory response, in the blood vessels in the heart. And that leads to damage in the arterial lumen and the inside of the artery, and the body uses cholesterol like spackle. And then at some point, the immune system decides that the cholesterol is foreign, attacks the spackle. So that's why heart health has nothing to do with cholesterol. The protocol for heart health is all about inflammation in the arteries, the capillaries, and the heart itself. I'd still go, you can't change lipoprotein A into lipoprotein something else. It just is what it is. And it's what your liver is going to put out. You're not eating lipoprotein A. Your liver has a gene that makes you put that out in addition to other stuff. Reduce inflammation, treat the vagus, treat the liver, and see if you can get it back. We've got 5 minutes left. Let me get down here to. Hi, Sherry. What about a high LDL 170? Yikes. 210 cholesterol, normal, like completely normal in somebody that's 69. LDLs that high, not great. 210 cholesterol, normal, completely normal. Just started statins. No, just, okay. I feel like a voice crying out in the wilderness. He's starting to get body pain. So just tell him the body pain is related to the statins. If you feel his muscles, they'll be like gummy and stiff. And if he won't argue with his doctor and get off of statins, just put him on 200 milligrams of CoQ10 twice a day. And it can take about a week, but the body pain will go down and the muscle pain will go down. He's active. That's good. I don't know why his HDLs aren't going up. His HDL-LDL ratio is not good, not with that kind of LDLs. Those desserts, but did a 3-month diet without dairy, gluten, or sugar stuff. Good for him. It might change the LDLs. If you can't get him off the statins, get him on CoQ10 so that the muscle pain will go away. Because if it's doing that to the mitochondria and the muscles, it's doing that. Statins are doing that to the mitochondria and the brain. So the highest concentration of mitochondria is in the brain, the heart, and the skeletal muscles. We feel it in the muscles, but if it's affecting the mitochondria and the muscles, it's affecting the mitochondria and the brain and the heart. If you can't get him off the statins, he's motivated. So explain what the statins are doing to the mitochondria and that the statins block the production of cholesterol above the place where that pathway splits into cholesterol and CoQ10. And you need to supplement CoQ10 if you can't get him to get off the statins and go on cholestyramine. Cholestyramine's innocuous. It doesn't cause any side effects. It's not going to cause dementia or rhabdomyosis or total global amnesia or any of the things that statins cause that they ignore. And the other thing I have about statins is there is no zero, as far as I know, as of, I don't know, a few years ago, there are no studies showing that statins are useful or lowering cholesterol is useful in primary prevention. So all the studies on statins have been done on people who've already had one heart attack. Granted, an LDL of 170 is not bad. I don't know what the data is on statins' ability to lower LDLs. They're going to lower the cholesterol. And the problem with lowering the cholesterol in a 69-year-old male is that inside of about a month or two, his testosterone is going to drop. And in addition to the body pain, his testosterone is going to drop, which is going to make him depressed. There's just all sorts of, so start with the CoQ10. Yeah, the diet didn't change the LDLs because his liver, he's on CoQ10. He already has erectile dysfunction before the statins. So erectile dysfunction has to do with vascular inflammation and a problem with nitric oxide. Nitric oxide is what lets you have erections. And that's what's the blue pill? Anyway, that's what that medication does, is it increases nitric oxide. So does the vagus. Of course, it increases nitric oxide in the brain. I don't know if it increases nitric oxide in blood parts or in blood vessels in general. But I had a practice partner one time that ran the peripheral neuropathy protocol from the low back to the feet with the patient sitting in a rocking chair. And not only did his diabetic neuropathy go away, his erectile dysfunction got better. So you could treat inflammation in the blood vessels from his neck to his crotch and hope for the best. Fascinating. You guys are really fun. I had so much fun. And I didn't have to make anything up. I just answered questions. This is what we're going to be doing in the masterclass in Hawaii. Oh, wait, congestive heart failure, heart muscle. Where's Louise? Sorry, Louise, I missed that part. Okay. Suzanne, 80 years old, saying he had a heart stent and did not have high cholesterol. That's because the plaques have nothing to do with cholesterol. Yeah, the plaques have to do with inflammation and the body and blood pressure. Some imbalance now in CoQ10, 2 weeks off. He's still on statins. The body uses cholesterol to spackle to repair the inside of the blood vessels. Thank you, Mark Houston. And then you have to ask, when is it that the arteries get blasted? What causes injuries in arteries? High blood pressure. Does he have sleep apnea? Does he snore? That's when you have sleep apnea, your blood pressure goes way up and damages the blood vessels. Look for infection. And it's 4:00. We did it already. Yeah. I like the idea of running 40 and 62 and 40 and 162 from the neck to the crotch and see if you can affect his heart and his erectile dysfunction already. That would be fun. And then concussion in vagus, because the vagus nerve tells the body that there's no tiger and calms the immune system. If you think about the fact that the vagus has as its job to quiet down inflammation, then you want to run the vagus to quiet down inflammation, because inflammation is what's causing all the chaos in the blood supply, in the brain and the heart and the blood parts. This was really fun. I don't have anything magic to say at the end, except keep doing good things, keep thinking, keep putting the puzzle pieces together, change lives, do good work, and I'll see you next week. Love ya. Bye.
The Frequency Specific Microcurrent podcast has been produced by Frequency Specific Seminars for entertainment, educational, and information purposes only. The information and opinion provided in the podcast are not medical advice, do not create any type of doctor-patient relationship, and unless expressly stated, do not reflect the opinions of its affiliates, subsidiaries, or sponsors, or the hosts, or any of the podcast guests or affiliated professional organizations. No person should act or refrain from acting on the basis of the content provided in any podcast without first seeking appropriate medical advice and counseling. No information provided in any podcast should be used as a substitute for personalized medical advice and counseling. FSS expressly disclaims any and all liability relating to any actions taken or not taken based on or any contents of this podcast.